to Syringe Services, harm reduction, and the role they play in preventing overdose in Tennessee. My name is Amber Coyne, and I act as the End the Syndemic Tennessee coordinator, and I will be moderating today's panel. International Overdose Awareness Day is held every year on August 31st to raise awareness that overdose death is preventable. Remember those who have been lost to overdose, and chip away at the deep stigma that is associated with drug use and drug-related death. There are many approaches to addressing the impact of drugs in individual lives and in communities. Harm reduction, which includes syringe services, is one approach. As the author of Undoing Drugs and fierce advocate Maya Salvovich says, in essence, harm reduction is radical empathy. The basic idea that regardless of whether people continue to use illegal drugs or engage in other problematic behaviors, their lives have value. Study after study shows that this approach does work. It saves lives, it links people to treatment, and reduces the likelihood of folks acquiring bloodborne pathogens like HIV and hepatitis C. Syringe service programs are not just about passing out sterile syringes. They are comprehensive programs that provide care and compassion for those using drugs. They test for HIV and hepatitis C, safely collect used syringes, and link those ready for treatment to care. They provide wound care, provide tools for safer sex like PrEP, and repair that often broken trust that people who use drugs have with the healthcare system. Syringe service programs are changing lives. You will hear today about how valuable this approach is to reducing overdose in Tennessee. Before we dive into today's panel discussion, I would like to take a moment to remember all those lost to overdose. These are our friends, family, partners, neighbors, and fellow community members. Join me in a moment of silence as we remember them. May we all continue to dream and build a future without overdose. Today, we've brought together a dynamic panel of people providing syringe services and harm reduction in Tennessee. We will hear about the work they do and how it has impacted the lives in our state. Towards the end, we'll have time for audience Q&A. If you have a question, please place it in the chat box. Now let's give a warm welcome to our panelists, starting with Deidre Grunter, who has been serving communities across Tennessee for a decade. With an MBA and degrees in criminal justice and social work, she has been working with the ETSU health system since 2016. In her current role, she oversees a program that includes access to PEP, PrEP, community outreach, testing, harm reduction, and linkage to care. Next, we have Ron Bobal, founder of A Better Way alongside his wife, to serve those impacted by substance use, advocate for improved treatment options, and ease the stigma associated with drug use. Please give a warm welcome to Sam Armbruster, who works at Choice Health Network, Harm Reduction in Knoxville, where they serve as the outreach and data manager. Sam has a master's in public health with a concentration in behavioral, social, and community health from Indiana University, and a Bachelor of Arts degree in gender studies from the New College of Florida. Throughout their career, Sam has been dedicated to improving health outcomes for people living with HIV and hepatitis C, LGBTQ people, and providing affirming and harm reduction care. And last, of course, not least, we have Austin Carroll. Austin Carroll lives and works in Memphis, Tennessee, where he acts as the Syringe Service Program Coordinator for the Memphis Area Prevention Coalition. Please join me in giving a warm welcome to our amazing panelists. For our first question, I want to dive into the story of how each of you came to be involved in harm reduction, and specifically syringe services in Tennessee. We will start with Deidre.
A little bit of a roundabout way for how I was actually kind of introduced into harm reduction. It was always something that I was very passionate about. But when I first started at ETSU, we did not have that program that was available. We also didn't really have a prevention program that was available. And for me, it just kind of seemed counterintuitive that we had resources for how to avoid HIV transmission and not have a way to actually prevent it that was going to be accessible for folks. So it's kind of like having a running faucet with water and just throwing paper towels at it. At some point, we've got to actually turn the faucet off and get people connected to the resources that they need. Personally, I've had a connection to harm reduction just because of that area that I grew up in. Being in East Tennessee, there is a significant need. I have family members that have been affected. I don't really know anyone that's not been personally affected by either opioid use, overdose, some type of harm reduction need. And so it just kind of went hand in hand that we were able to just add on services that were going to help people. Our number one goal has always been to help people and make sure that it's always person first. And so for us, that was just something that we wanted to kind of add into the service options that we have. We wanted to make sure that people were recognizing that we were going to meet them where they were and not necessarily where they needed to be, because creating barriers for people by kind of setting up a standard of this is where you have to start at to be able to get help isn't going to actually get people in the door. And so we wanted to just remove all of the barriers for folks to get into care with us here.
Awesome, thank you. Next, Sam, can you tell us a little bit about how you got involved in the field of harm reduction and syringe services in Tennessee?
Yeah, absolutely. So kind of in the way that Deidre shared that she had a little bit of a roundabout experience for getting into harm reduction. I actually was first introduced, and it feels really important to acknowledge this. I was first introduced to the concept of harm reduction by a trans woman named Bryn Kelly, who passed away a few years ago. And I went to a panel that she did, and she talked about harm reduction and sort of the intersections of living as a trans woman who also was living with HIV, and just sort of navigating spaces and things like that. And that talk really drove me to want to get involved in public health and do work with HIV prevention. And so it was kind of in the back of my head, but I think I had like a more traditional prevention mindset. And I moved to Indiana to start my master's degree, and I met the folks who run the Indiana Recovery Alliance, and they were doing incredible work. And it sort of clicked like, so HIV prevention is something that I'm super passionate about. And I grew up in a rural community where lots and lots of people that I love use drugs. People in my family use drugs. And so it felt like a way to really marry those passions to be engaged in harm reduction. And when I moved to Tennessee, I actually wasn't working in harm reduction, but I was still like really aware of the things that were happening, and trying to like give money when I could and be engaged in whatever way that I could. Um, and I kind of like serendipitously fell into this job through a connection with a friend and my now supervisor. And I've been doing this work formally for almost 2 years now. And it's one of those things where I feel so lucky every day that this is something I get to call like my job, right? It's something that I was engaged in before. And so it's just really special that this gets to be the work that I do every day.
Thank you, Sam. Austin, how about you? How did you get involved in syringe access and harm reduction?
Well, I have plenty of experience in harm. And so I think that turning it around to harm reduction was a great was a great idea. Actually, no, I'm in recovery, and as a former IV drug user, poly drug user, um, I I kind of made it my mission when I got sober to work in the addiction field, um, or excuse me, the substance use disorder field. Um, and I went to school and got the schooling that I needed for my LADAC, but I really wanted to work on the front lines, and I had actually gotten involved really early on with Ron and Lisa over at Better Way. And then MAPC was starting an SSP, and it just kind of fell into my lap. I had some friends that worked over here, and it was just something that I really wanted to do. When I was using, this was not a thing, and I really wish that it would have. And I remember looking up needle exchanges, and I saw that there was one in Nashville, Streetworks at that time. But that was obviously too far for me to go. So there is such a need here for SSPs and for harm reduction and for just getting naloxone and everything out on the street. So it's just something that I really love being a part of. Working one-on-one with clients is really the best part of this job, and that's what I really, really, really enjoy the most. And it helps to be able to speak to somebody from experience and to know their language and to speak that language as well. So I'm really grateful to be able to be a part of it.
Thank you, Austin. And finally, Ron, how did you get involved in syringe services and harm reduction?
Can y'all hear me okay? I just wasn't sure about my mic setup. Y'all got me?
Perfect.
First off, that's not a halo above my head. That is a ceiling fan. So just to make sure it's not an app. I raised 2 heroin addicts. So I'm at this from the point of a parent that when we lost our son to basically fentanyl overdose, we were looking for something that to give back to the community and some of the lessons that we had learned along the way from, a different set of life experiences, so to speak, that took place. And we were there at the right place at the right time when, the SSPs were starting to roll out for, West Tennessee. And we knew that that's what we wanted to do. And it's been an incredible journey, but it's one of these things where anybody can get involved and help like this. You just have to stick to it and just make it happen. Surround yourself with positive people that, without the volunteers that we have, I could just be one man out here, but we have an incredible group of volunteers that want to be of service to others. And it's that's the real magic, is having that, and we look forward to the next chapter in Memphis. We just want to raise awareness to what's going on, not only just in Memphis, but what that we've learned out here on the street, and being the tip of the spear with the addicts, and help everybody else that gets started in this if they ever need any type of assistance, how to get over the hurdles and to know what's next.
Thank you, Ron. Next, I want to dive into how you all see the role, like what role harm reduction and syringe services play in preventing and reducing overdose in Tennessee. And we are going to start off with Austin for this question. How do you see syringe access and harm reduction reducing overdose?
Well, I think that, education is obviously extremely important. We are fortunate enough to have a ROPES, regional overdose prevention specialist with us at all of our SSPs to be able to train people to use Narcan, obviously. So that's a huge one. And then I think, just passing out Narcan, I think is huge. I know that since March of last year, just from what we've recorded, I think we've recorded like 365 reversals just from our SSP alone. So I think obviously getting out Narcan is hugely important. And then just helping people understand, like I've been kind of an advocate lately for fentanyl test strips because we have so many people in Memphis dying from fake pills. For the first time, Black males have surpassed white males in overdose deaths in Shelby County. And so, we've been able to get some through private donors and stuff like that. And so just educating people on the fact that if you're buying pills off the streets, you have no clue what they are. They are made so well, they look like the real thing. A lot of times even trained eyes cannot distinguish between the two. And so passing out those fentanyl test strips, teaching people how to use them, making sure that they have Narcan. I think that that's been a huge role that we play in Overdose for sure. And just showing up week after week with the same supplies, letting people know that we're there. Word of mouth is definitely how we have built our SSPs up. So yeah.
Thank you. It's fantastic. I'm seeing hearts and thumbs up and lots of claps to a lot of the things you were saying. Ron, what role do you see harm reduction and syringe services playing in reducing overdose?
I look at it this way: we're the tip of the spear. We're the people that are closest to the people that are using, and we're there to basically. We have just a few rules, when we operate. It's there's no judgment, no expectation, and everybody's welcome. And part of that is to establish relationships with those in need, and to provide familiar faces, much like Austin talked about, being there, and being there whether it's cold, whether it's hot, and to always be there to serve them and to go above and beyond. I know I stress that with our volunteers, and they kick me for wanting to stay a little bit later because somebody missed or was a little bit late and stuff like that. And it's these little things that reflect value back to those that are using. And if you can get a thank you out of somebody that has been at their lowest point, and you reflect some sort of value in them, that's a step towards recovery, so they know that somebody cares somewhere,
Yeah.
and I think that's the real thing there. I mean, we're all providing wonderful services out here. It's that human element that we've got to really work on. And, it's just one of these things where I think that this is going to snowball if we can get people to pay attention to what we're doing in the community and to highlight the issues that we're having and what it takes to provide enough service for the folks that we have a little bit of apathy here because we don't have what we need to fight this fight as well as we want to. And by constantly illustrating what we need, we think that in a professional manner, it's not that we're just going to, complain constantly, but it's to illustrate with facts and data. We harvest a lot of data between all of our SSPs. And if we can show that we need more detox beds, we need perhaps to look at the length of stay for detox. We need to increase that. We need to increase the 28 days to 90 days. So there's a lot of campaigns out here that we want to be on the forefront. And just as Austin illustrated, the absolute availability of naloxone, Narcan, if we can make this so available, that's where it needs to take off. If you're getting out of jail for a drug charge, you need to walk out of there with naloxone or Narcan in your hand. You need to be able to find some way, I don't know if it's at our community centers or fire departments or something like that. And I want to stress that if we can get those folks involved to help us with the distribution of Narcan, because we're out in these fields, 1 and 2 days a week, but the fire department's there constantly. So if we could work out a campaign to where people could go to their local fire department and get naloxone or Narcan for themselves or their loved ones without judgment, I think that we're going to save more lives. We just have to flood this market with it. And realize that it's just such a needed thing, because without somebody being alive, there is no recovery.
Thank you, Ron.
Mm-hmm.
Sam, what role do you see harm reduction and syringe services playing in reducing overdose?
I think for me, and I'm going to echo a lot of the things that Ron and Austin have said already. But I think one of the most important things that I see is, obviously giving people supplies to help stay safer and reduce opportunities for HIV and Hep C, and those things are very important. and I don't want to minimize that, but I do absolutely think that being someone who is consistent and steady, and there, on like a weekly basis for people, that they know they can come and see us and that we're going to listen when they talk to us, and that we're not going to impose our values onto them, but rather we're just there to meet them where they're at, and not shame them or make them feel bad or talk down to them or anything like that. And I think that building those connections is really meaningful. And I think it also gives people an opportunity to connect with other folks who use drugs in the community as well. And I think that having those two pieces is really essential, because if people aren't being forced to isolate and use alone, because they're afraid of how people are going to react to them, I think that that does a lot to reduce potential overdose. I think also obviously sharing information like the Never Use Alone hotline and things like that with people, so that if they aren't able to make those connections or don't want those connections, that they have someone who can be there for them. And then I think Ron is absolutely right. Flooding an area with naloxone so that people who use drugs are able to reduce overdoses when they happen, because we know that the true first responders to overdose are the people that are using drugs with other people, right? Like they're there. And so having access to naloxone when they need it is essential. And I think that the more that we can do to support people having access to naloxone is essential. And I think that that's something that we're going to have to think a lot about as we face the naloxone shortage, and really be mindful of how to still meet people's needs. But I think definitely being consistent and connecting with people and giving people what they need and listening to them are really essential ways to help mitigate overdose with harm reduction.
Thank you, Sam. And last but not least, Deidre, how do you see harm reduction and Syringe Services reducing overdose? I think you're still muted.
Can you hear me now?
Yes.
Okay, sorry. I was saying I definitely think that I need to piggyback off of what everyone has kind of already said as far as meeting people where they are. One of the first things that we always tell people whenever they come to us is like, welcome. And so people always come like as new participants, and you can just see like there's so much just like anxiety kind of around coming to us, and it's like, welcome, like you're safe here. And so being able to tell them, our service is free, but it's not just free as far as like you don't have any like financial cost associated with it. It's free of judgment. Like we are here to help you regardless of whatever you need. And so we get told, and I tell people all the time, like, this is not true. Like, we're just treating you like a person. But like people tell us all the time, y'all are angels. And it's like, we're absolutely not angels. We're just treating you with respect and dignity. And so I think that's one of the first things that really is something that just providers need to take away. For us, we've seen people that have never been willing to go into any type of healthcare service before, whether it be for Hep C treatment, whether it be for mental health treatment, whether it be for, addiction management, anything. They've not been willing to go and seek out the care that they've needed, even for overdose, because they've been treated so badly. And so to recognize that they can go to a healthcare professional, healthcare setting, healthcare location, just anything, and be treated appropriately is very normalizing for people. And so they recognize that there is something that they can do to be able to get care. One of the other things that we've seen, this is more of the logistical side, and it kind of goes against what you would automatically think. When we first started the program, we would have people that were coming in and saying, I'm only using like a couple of times a day. I'm only shooting X amount of times a day. And so then we kind of saw where their numbers were starting to go up. And what we realized were people were so accustomed to using syringes that were very much not safe for being used. They were very dull. They were having to sharpen them, and it was really painful for them to have to use. They were using really, really high amounts of drugs in a lot fewer shots. And so by being able to have access to sterile syringes, they were able to do maybe more shots in a day, but with a lot less drug. And so that significantly reduces someone's overdose if they're not having to use as much drug in one shot. And so that also is something that is helping people be able to stay safe. I know for us, we see about 50 to 60 new people a month, just because of word of mouth and because people are saying, we feel like we're going to be respected here. And so in addition to the Narcan that we get out in that capacity, we're also getting out between like 400 and 420 additional boxes on average. This is just over the average of the year. We've been able, thankfully, to get more, but we're getting out almost like an additional 420 boxes of Narcan to people that need it. And so, going back to what Sam was saying, as far as like who the actual first responders are, it's absolutely people in the community. They're actually there when the overdose is happening. That's never going to get reported to 911 or anything else. And so for us to be able to recognize and really empower them and help them understand also, like, you are doing harm reduction, because they thank us all the time, like, oh my gosh, thank you so much for what you're doing. It's like, thank you, one, for being available and being willing to help somebody, because a lot of people will walk away. A lot of people I've heard, like healthcare professionals, not people that are actually using, but people that are healthcare professionals will say, why do you want to use Narcan on someone? Like, just let them die. And like, that is disastrous as a mindset to have in an actual healthcare setting. But to know that people are out here doing it, like, it's really important to recognize them, empower them, and let them know that they're also doing it, because that's going to give them the just respect that they need and the recognition within themselves to be able to really say, I do have worth, I do have value, I do have meaning, and I can make a difference also. And a lot of times that's all it takes for someone to be willing to say, okay, I'm going to kind of turn this around, and instead of actually kind of being on the end of where I'm struggling with the addiction, I'm willing to take that next step so that I can professionally help someone else get into care. So there's a lot of different ways that we're able to actually help with overdose, and it's not always the ways that you would think. In addition to just like the Narcan, it's definitely showing the compassion and the dignity and just letting someone be recognized as a person, because that gets taken away way too often for people that are struggling with addiction. We never want to call someone like, oh, you're just an addict. You're a person first. You're always a person first.
Thank you. And I see Sam putting in the chat box, people who use drugs are absolutely harm reductionists. And
yes.
Absolutely. So thank you for that comment, Sam. Next, I know that oftentimes in doing this work that you guys face misconceptions about syringe access, about harm reduction. So I kind of want to talk through, what are those misconceptions that you face in doing this sort of work, and how do you respond or change the hearts and minds of people who maybe don't know a lot about harm reduction or have misconceptions about harm reduction as a field? And I want to kick off that question with Sam.
I think that a lot of people, the misconceptions that they have just come from a true lack of knowledge and lack of exposure to harm reduction. I think that one of the things that stands out to me most is that I hear lots of people say that they fear what harm reduction programs coming to their community might mean for their community. And the idea that like it will bring people who use drugs to their community or something like that, and that that's inherently bad. But the reality is every community has people who use drugs in it. And there's such a spectrum of what drug use looks like for people. Some people might be using chaotically, and it might be a detriment to their health, or like they might be unhappy with the fact that they're using as much as they are. Whereas there are some people who are living their day-to-day life just using drugs, and that's fine, right? And so really I like to remind people that from my perspective, the goal of harm reduction is to empower people to live their life in like the best way that they possibly can. And that doesn't mean for me that they need to be sober or that that's the end goal, right? Like the end goal is for people to be empowered to live their life in the best way that they see. But I also think that like a lot of people have perceptions from media that people who use drugs are dangerous or bad or something like that. And so it's always really interesting to me when people come and visit the exchange and see that like most of what we do is like having conversations with people about their lives and having people share really high points and really low points and things in between with us all the time. And that it's not all that exciting. It's just a lot of talking to people and giving people supplies that they need. And I really wish that more people were able to know that that's what it looks like and that it's not making a community more dangerous or anything like that, that it's really pulling people who are already community members further into the community and really giving them spaces to be without being judged. I think that's one of the biggest misconceptions for me. Um, and so, yeah, that's kind of what I'm thinking about when I hear that question.
Thank you, Sam. Ron, what are some misconceptions you've faced and how do you respond to those?
It can happen almost anywhere. It happens with, law enforcement. It happens with first responders. It happens with, you know, alluding to, like someone that made the comment about why would you Narcan somebody that's using drugs like that? That's that's the hardest thing to when somebody is in a professional capacity to serve our community, that they have feelings like that, and that's really frightening to me that could happen. I mean, we have some very interesting policies because we're not a metropolitan area. We have a county government and a city government, and I've sat in at the county government's response with law enforcement with Narcan, and it was to wait until backup came to administer the Narcan to the person that was overdosing, and I thought that just flabbergasted me, and we wanted that. We'd like to see that policy changed, but because there's a lot of one-man cars, and they're fearful that someone could help cuff them and give them the Narcan. You know what I'm saying? If you're fearing for your personal safety, but somebody's they're overdosing, they even gave instructions to give them CPR until backup came to properly administer the Narcan. And I thought, we're really missing the boat here, and it's those kind of things that you think are given in your community where everybody's on board to save people because they don't understand that addiction is a disease, and it's so much more beyond these quote unquote moral injuries that we think are taking place. And it's you get these folks are trapped into this life, and it's so powerful that it makes good people do things that they never thought that they would do to obtain the drug they need. I mean, that's literally so how can I say it? It's just the common person that doesn't run across this doesn't understand that. So we've got to relay that these are still good people out there. They are just stuck in this life and they need help. They need our community's help. And we need to get beyond the shaming. We need to get beyond all the stigma and put this away and start saving lives. That's the bottom line.
Thank you, Ron. Deidre, how have you rebutted misconceptions about harm reduction and syringe access?
I definitely think what Ron was sharing is absolutely accurate. A lot of the time we see the challenge, it is more so coming from professionals in the community. And so a lot of the fear is exactly what he shared. Why are you narking someone that is using drugs to just give them the opportunity to go out and use drugs again? And the thing is, it's not just giving them the opportunity to go out and use drugs again. It's giving them the opportunity to go out and live again, to be able to get to a place of where they're not going to use or they're going to use more safely. It's all about education and being able to give someone the opportunity to live the life and be the expert of their own life and what they need to do. So our thing is we're not trying to force someone into something that they're not ready for. That's also been something that has been a challenge for people. Like, are you going to force them into care? Are you going to force them into treatment? How quickly do you get them into treatment? And it's everyone's life is different. I can't tell you what's going to be the best fit for any particular person. I've got to work with them to actually find out what's going to be the best fit for them and keep them safe. A lot of people have concerns in the community. I think Sam had shared about just, there's going to be more syringes in the area. And so for us, one thing that's kind of been, I guess, a really educational point is for us, if anything, this has reduced how many syringes are in the community, because there is an incentive. People don't want to come back empty handed. They get more syringes from us when they bring things back. And so there's always going to be that incentive just to say, I'm going to, if you gave me 10, I'm going to bring the 10 back, because that means I'm going to get 10 again. There's also a challenge associated with that. That's a state point for point rule, which we also know can sometimes have its own challenges. But as far as like what the community and their interest is, there's a benefit to having a syringe program in the area, because it's going to cut down on a lot of the other challenges. Sometimes when we still have people that are still like, I'm not buying any of that, that's not something that I'm interested in. Almost everyone hates waiting for a long time at the emergency department. Everyone hates waiting for anything. And so trying to help people understand, if you have someone that is uninsured, that is going to the emergency department because they don't have any other access to care for things that could have been prevented, if anything else, you can at least appreciate the fact, for your own selfish reasons, that this is going to be a benefit to me. And so sometimes at least being able to start the conversation in that way and help people say, how does this help me? It at least puts us in a position to where we can kind of mitigate some of the concerns that people have. There's also a really big stigma associated with, well, those people, I've seen those people, they look just like drug users. And so for us, we always try and say, you can't tell me what someone that's using drugs looks like, just because you might see someone that comes through our harm reduction program that doesn't have the financial means to do anything else. Doesn't mean that that's the only person or what someone looks like. This is someone that's probably struggling with homelessness, or is really at a point of not being able to have a lot of resources. But we've also seen people that are accountants. We've seen people that are teachers. We've seen people that are social workers. We've seen people that are across the entire spectrum of life. And so helping people understand, like, oh, I didn't think about that. I didn't realize that. There's a lot of respect that's given for people that are veterans. And so helping people understand, we deal with a lot of veterans that are coming through. Just being able to kind of normalize for people in the community, because there's always been that stigma that's been really kind of propagated within the community of what someone looks like. And so just being able to normalize for the community what someone looks like, quote unquote, looks like, that's coming through and using harm reduction is kind of the same process that we would take for someone that's coming through looking at what it's normally like for someone experiencing appropriate health care. And so we really just want to try and, I think, just get out the understanding that regardless of what you previously thought, being able to have access to a harm reduction program in your community is going to be able to benefit everyone. It's not just going to benefit the people that are immediately accessing the service.
Thank you. And finally, Austin, what kind of misconceptions have you faced, and how have you reacted to those?
Well, I think that a big part of what we do is we serve a population that, I know particularly for Ron and I, we serve a population of people that people probably don't think about very often. The individuals that we serve, they probably don't pray for very often. They probably are just kind of the forgotten members of society. And whenever I go do education on these SSPs, just to try to reduce stigma, that's something that I point out. I think that a lot of times people just hear needle exchange, and obviously they think that we are enabling addicts to use drugs. And so I think that the most important statistic that I give out at those presentations is, from the CDC, and that is that people who attend SSP regularly or are part of the program are 5 times more likely to seek treatment than those who don't, which makes total sense, because you're showing up week after week, you're talking to somebody, like a lot of our clients, like I said, they're people who people don't think about. So you're showing up, and there's somebody there that's kind to you, that knows your number, that knows what you get every week, that knows about your life, and a lot of our clients have not had that in a really long time, and some of them, that's the only time that they show up and somebody's kind to them, and it's a familiar face, and you establish relationships with. And so I think that a lot of times when I explain that to people, and there are some of our clients who they are living their best life, and that is what they are going to continue to live the way that they are until they are no longer living, and that's okay. I mean, we serve everyone and try to build the same relationships with them as well. But there's some who are eventually going to get to the point that they're ready to ask for help, and we're there to serve them too. And so, I think that once people understand kind of the scope of what we do, that we're not just there to sling needles. We also give, obviously, other harm reduction supplies, life-saving supplies, but we also go a step further than that. Our community partnership detrimental to what being able to offer treatment options right there on the spot, being able to offer free cell phones, food, water. There's just a lot that we do. HIV and Hep C testing, access to care. We have a relationship with a pharmacy who has a collaborative prescriber agreement with another doctor that they can give out antibiotics and just certain things that our clients don't ever have access to. So being able to provide care, and being able to really meet people where they're at, and that's the other thing, like a part of this job, working in the SSP and learning really to meet people where they're at, has also shown me that the people who I have to quote unquote argue with about why we do what we do, I have to meet them where they're at too. Because I remember before I started this job, there was this attorney who I used to argue with on Facebook all the time about addicts. Like, I would just get so mad at him and say the most horrible things to him. And because he would say the most crazy stuff on Facebook. And, I've learned my lesson on arguing on Facebook. However, I was able to sit down with him recently and just kind of get an understanding of why he feels the way that he feels. And I was able to listen to him and try to have some understanding. And then I was able to talk to him about why I feel the way that I feel. And I think that, and I know that he got a better understanding of that. And so, when I talk to people, because there's people all the time who say, well, aren't you just enabling? I'm able to not get angry about it and to sit there and really have a good conversation. We had a client of ours die of an overdose in June, and for anonymity's sake, I'll just call him Marshall. And Marshall's wife got on our Facebook page a few weeks ago, about a month ago, and just eviscerated us. How dare us? If her husband hadn't have had access to syringes, he would still be alive right now. Just a lot of stuff. So, I didn't respond, because I knew that she was coming from a place of pain. And she actually showed up at the SSP that night to return his dirties. And I knew who she was as soon as she got there. She was crying, and I was able to step back from the table, give her a big hug, let her cry, let her be angry. And then I was able to kind of explain what we do, how much we loved her husband, how we talked to him every week, how we knew all about her, and how he was always talking about the fact that he hated that he had to hide where he was coming from her, just and just kind of let her know what she does, what we do. And now she volunteers with us. And so it completely changed the scope of things. So it's just little victories like that. That's what this whole thing is just these small little victories. It's these small little changes that we make one person at a time that really makes what we do worthwhile. And I mean, there's it takes one little minute at a time. It's one little person at a time. This isn't going to be an overnight thing, and sometimes that can be discouraging, and sometimes it's amazing. So anyways, that's all I got for that.
Thank you, Austin, for sharing that. We're almost at time, and I had one last question. There's two questions in the chat. I was intending to share some resources at the end of this, but for the sake of time, I am going to get those questions answered and have the resources in a follow-up email to everyone that has attended today. But before we leave, and Austin, you segued perfectly into this, I'd love if each of you, Sam, Ron, and Deidre, could share just a really quick success story, a little soundbite of something that stands out to you about the impact of these programs. And I'll start off with Deidre, if you'll start off that question.
It's hard to pinpoint and just say like exactly what is one thing, because honestly, we have people every single week that come up to us and can share, I was able to save someone's life because I'm still here because our, Narcan that we were able to give out. So it's really difficult to say just through like a professional way of something that just is a standout case, because we're constantly getting people connected to the resources that they need. On a personal level, one thing that is a standout for me is, as I kind of told everyone, like I have family that has extensive history of using drugs also, and the participant had no idea about it. My family member had no idea about it, but just because each one of them had kind of told me different pieces of the story. One of my family members is still alive because of the Narcan that I was able to give out. And so being able to see like they would not have been here had we not been doing what we were doing and been there at the time that was necessary, like it would have been detrimental for my entire family and that entire group within the community that I was raised. And so it's just like, and it's a reminder. It's one of those things of like, I have always been very committed to making sure that we are able to help people regardless of who they are. But when it touches home, it's something extra special, and being able to see that. And so I'm always able to kind of just remind people, I'm so thankful for you every single week when you're able to come back. And, we are so grateful that you're able to help other people when they're able to come back. But as far as like just a personal, this was extra touching. It's really, the family member is someone that was extremely close to me. And so just being able to see the direct connection, it's, like I said, there was no way that they would have known, but it absolutely was because of the service that we do.
Thank you. Ron, is there a standout story to you?
Yeah, I've got a couple. I'll try to do them real quick. Got one that piggybacks on the naloxone Narcan thing being available. We have a young man that goes at it really, really hard, and he was visiting his grandmother, and he had OD'd. It's the cardinal thing, using by himself, not making sure that somebody was there to make sure that he was going to get through it. He happened to have left the box of Narcan in the bathroom, and she didn't hear from him for a few minutes, was unaware of what he was doing in there, opened the door, knew that there was a health issue going on, instinctively picked up the box and followed the directions and saved that kid's life. That shows you right there that if we could just make this available, we're going to save more lives, even though she was an untrained person. I hate to say that in front of the state. But anyway, it was just their opportunity. And then the other thing is about what we're about. It's a lot of times the first time we get somebody into detox, or the first time we get them into somewhere, that's not always the fix, but it might be the beginning of recovery. You know what I'm saying? We've got a guy, let me rephrase this. We've got a young lady that we call, I will say she's our unicorn. She's a professional sex worker. First time we got her down to the steps of detox, she ran. She didn't want to come back to the exchange because she was scared. Here we are a year later, and now she's in the second phase. She's going to detox. She's going through a 28-day program, and now we're looking for a long-term program for her to go into that's trauma-based recovery. Another real quick success story from working with some of our partners, working with Catholic Charities for doing Housing First, where that means that you can be an addict and still qualify for housing programs. We've got a guy that's, now it's been 2 years. He went a year through Catholic Charities, and now he's still stable. That jumpstart to his life, being able to get a roof over his head and the stability that provided allowed him to focus on his recovery. And that's the only reason that he's still alive today. So it's just a couple of those stories, but working with our partners, that there's it's a small community out here, but it takes a lot of people to help. So.
Thank you, Ron. And Sam, if you will close us out on one or more success stories that you've seen in doing this work.
Yeah, absolutely. I think it's I think I've had to do in doing this work, as much as I've considered myself someone who's engaged in harm reduction, I've had to like reflect and kind of reframe what success looks like because it looks different for everyone. And so like a few like very short ones. I'm just thinking about the fact that we have someone who comes and just sort of sits in our waiting area on a regular basis and was incarcerated recently, and we were one of the first people that they came to visit, and like called to let us know that they were coming, and just like to not worry about them. And it's like, I think for a lot of people that wouldn't count as a success, but like having that continued engagement with folks is just so meaningful. And then we have stories of folks who are like, obviously, reverse overdoses amongst friends and family, but then who will be at a gas station and experience someone else overdosing, um, and have naloxone that we gave them, and they're able to save the stranger's life, and like they don't know that person, but they're able to make that meaningful impact, and keep that person around who inevitably is important to someone, right? And so I think that every time that I get to sit with someone and share um, something that feels impactful to them, that feels like a success to me, no matter how small or big that may be.
Love that. Thank you, Sam. And Austin has one more success story that he wants to share. So he's actually going to close us out. I will be following up in an email. I see that there is some interest and we need more syringe service programs in rural Tennessee. And one of the things I was planning to share with you is how you can apply to start an SSP in your area. So I'll be following up an email to everyone that's attending this call with those resources. So stay tuned for that. And I will get those 2 questions answered and provide that in the email as well. But Austin, if you will close us out with a success story that you have.
Absolutely. And I just want to say that on piggybacking on what Amber just shared, I know that I'm happy. I'm sure that anybody else on this panel is happy to answer any questions as well, and just kind of what worked for us and what didn't. And, anybody can feel free to reach out. When I was thinking about this question, I was thinking about, all the people that we've gotten into treatment and all, like what we would view as a success. But just kind of going on what Sam just said, we have a client who we've probably, I think that since I started here, we've probably gotten her into treatment 11 times. And, she suffers from co-occurring disorders. She is really, really precious though. And I'll never forget the day I went to check on her. She lives in an abandoned house over by the Home Depot, and I literally just got tears in my eyes when I was walking in there and seeing what she lives in every day. And there was a while that we had gotten her into treatment, and we drove her a long ways away. And then I see her back in a couple weeks, and just with so much shame and so much guilt for not being able to make it work. But I don't know that she'll ever be able to make it work, and to live the life that she wants to live. I can't say that for certainty. I've been to treatment 12 times myself. But one thing that's really amazing is that one day, 2 of my coworkers saw her in the Home Depot parking lot, and she was, probably gonna die if somebody hadn't intervened. And she's not somebody that you would look at and probably go intervene with if you're just a normal everyday person. Um, and they were able to get her help, get her into the hospital. And I think that those kind of things, meeting people where they're at, I think looks so different in so many ways. But being able to be there for somebody, you know, being able to go by and check on them, knowing where they stay at, knowing, you know, just making sure that they're okay. You never know when that's going to save somebody's life. So success doesn't necessarily look like necessarily what we think it does, but I do know that she probably wouldn't be alive today if it weren't for this SSP, you know, and just having somebody that shows up every week, knowing that they care about her, you know, telling them that you hope that they have a great week and that you've been thinking about them. I think that goes so far. So that's all I wanted to say. But thanks for letting me share that, Amber.
Thank you. Thank you. I want to just thank all of our panelists today. These were amazing discussions and stories. I'm trying not to cry right now. If you guys could all show them some love in the chat box. Thank you everyone for being so